Align the knee, align the body and mind. Namaste friends. I am Ritesh and today our topic is yoga knee alignment. Friends, increasing number of senior most yoga teachers are having serious hip problems and many may require surgery. According to a recent report, BBC News, a leading UK-based specialist, Mr. Binoy Matthew, who is a hip and knee physiotherapist, informs that he sees increasing number of yoga teachers with serious hip problems, many of whom require surgery because they are pushing their body too hard. Mr. Matthew suggests, don't push if your body physiology prevents it. You can explore, but just be careful. About half of the teachers and yoga practitioners simply need advice on how to moderate the yoga practice so as not to put too much of stress on their joints. Knee pain is quite frustrating, and with slight misalignment of the knee, especially asana such as Padmasana, Virasana, Trikonasana, Vajrasana, Virabhadrasan and Malasana, to name a few, if done wrongly, repeated over months and years, can give you pain and long-term joint problems. On the other hand, asanas practiced with awareness of breath and conscious good alignment of leg bone and joint can be the best way to build strong, healthy knees. Knee is a hinge joint, the biggest synovial joint in the body. There is no bony stop at the back of the knee like there is in the elbow. The ligaments, joint, capsule and tendons have to restrict further posterior movement or hyperextension movement of the knee. Knee, ankle, one line is a common alignment cue we always hear. But today, let us see how much right is this cueing. Friends, let us see different variations of Virabhadrasana 2. The knee in relation with the foot, and then we will find out solutions to these variations. So in the first variation, we have the neutrally aligned knee and neutrally aligned foot. In the second variation, we have valgus, internal. We have medial rotation, so we have valgus knee and pronated foot. In the first variation, we talked about knee neutral, your ankle or foot neutral. This is what is desirable and this is what we always talk about. In the second variation, what is happening is the knee is going into medial rotation. So, and at the same time, my foot is getting pronated. So now what is happening, if someone is having a position of warrior 2 like this, where the knee is going in, the simple correction is just take them in one straight line. So the foot has a good foundation and the knee ankle is in one line. Here you can also work on the abductors to strengthen the abductors, to strengthen the quads and hamstrings. That's completely fine. There's a solution. You can always just ask them to make it a little bit more out, and that's completely fine. In the third variation, we have Veram knee, but neutral foot. So my knees are going out, but my foot is still neutral. In the third variation, if we start to correct the Veram by pushing the knee in the center, the universal cue of knee ankle in one line, you will find that the foot is being pronated, and that is not desirable. In the third variation, what was the alignment of the foot? The knee was varus. The knees was going out, but the foot was neutral. That means the foot was in a proper alignment, but only the knee was going out. In that case, what you are doing is, if you try to push the knee in, your foot that was neutral would get into a pronation. So now it is okay to have the knee into varum, but keeping the 3-point connection of your foot. In the fourth variation, we have valgus knee, but ankle is neutral. My foot is neutral. So if I start correcting it by pushing the knee in center, what will happen? My foot is getting into a supination. Now, in the fourth variation of Virabhadrasan 2, the knee is valgus. That means the knee is internally rotated, but my foot is neutral. Now, if my foot is neutral, keep it like that. Why? Because if you start pushing the knee in the center, and in case your foot is supinating, definitely that is what is not desirable, because we need the 3-point connection of the video that I have discussed earlier, that whenever your foot alignment is, it should have a 3-point connection. So if it is valgus, but if your foot is neutral, you can give a little bit of correction, but see that the foot doesn't get into a supination. If it is varus, but if the knee is neutral, then don't need to push it back. It should not disturb the 3-point connection of your foot. That is the link given here. So go through the video of 3-point connection of the foot to understand better why certain situations we don't need to correct it and certain situations we need to correct it, depending upon student to student. Hope you understood the 3-point of connection between the foot and why the knee ankle is not always used in all the alignments. Depending upon student, different alignment cues are given. Friends, there is one more way people doing a warrior 2 is where they push themselves to go more down into this position where the thigh is more parallel to the floor, and they call it that warrior 2. Now friends, if you're going too much down and there is a strain coming on your knee, please avoid it. In fact, if you have the knee a little bit more forward or a little bit more backward, no problem. So if you're having a strain on the knee, you can still have a warrior 2 in this position, and eventually, as and when you practice, you can slowly go down. What will happen is, as and when you go down, you're strengthening the quads, you're strengthening the hamstrings, and in return, you will strengthen your knee joints. But go gradually, go slowly and gently. It will help you a lot. Friends, it's quite easy as yoga teachers and practitioners to correct knee ankle one line because it aesthetically looks good and it is easy to see and judge. Just because the knee falls inside, that is valgum, or outside of the foot, that is varus, does not mean we should change the orientation. We have to look more closely and check out what knee movement is doing to the foot. So sometimes it is good to give stress, but remember friends, understand your body. If there is an electrifying pain in the knee, you need to stop. Else there is no harm in giving your ligaments and tendons a little bit of stress. It needs to. Friends, hope you enjoyed my video. Thank you for watching. Namaste.